Hello, this is Dr. Kevin Connors with Michelle Hamburger.
Hello.
And we're going to address a question today. And we've gotten a little grief that my picture down here in the corner is a few years old, so I thought I would change it. Thought that'd be better.
Such a handsome, is that a bow tie?
I think so, yeah.
You look
bow ties.
You look very happy to be wearing it.
Yeah, well, it was a family picture, and at that age, you're not really keen for family pictures, I'm sure. So,
yeah, the photographer is getting some serious evil eye from you.
Okay, so we had a question about what? Chemo and...
Yeah, so we've had a few patients and non-patients who have let us know that they've heard from other, I don't know if they're medical practitioners or just people that they were, respecting their opinion. And they've been saying that using the RIFE when you're doing chemo is a bad thing to do, that it can actually, it won't benefit you to use them in conjunction with each other. So wanting to clarify that.
Yeah, we've heard from a lot of people, well, not a lot, a few people, maybe half a dozen over the last couple of years about, somebody told me I shouldn't use the RIFE while I'm doing chemo, and I think that's a misunderstanding of what the RIFE does. When you're doing chemo, understand, is a poison, and a poison is an oxidizing agent. So typically, we don't want to do any antioxidants if we're doing chemo. There are some limitations to that statement, and we'll talk about that in another Members Minute. But the RIFE is not an antioxidizing agent. So the RIFE is not contraindicated with chemotherapy. Matter of fact, I think on the contrary, what the RIFE does is there's multiple theories on what using a frequency generator with light frequency does to a cancer, but certainly, undisputedly, it causes that cancer cell to vibrate. It can cause the cancer to uptake nutrients more so, especially stimulate an immune system against itself, and that's the whole purpose of the RIFE. You're trying to stimulate an immune response against that cancer, and that's not an antioxidant response. So understand what that means. Also, we want the chemo to work on the cancer cells. And I think when you use the RIFE, you help target the chemo to the cancer. Problem is, the chemo is not necessarily targeted to cancer, right? It's going to your whole body, right? Mm-hmm. So the danger of chemo is that it's killing healthy cells, and that's what makes us sick, and that's what damages our immune response, and that's what causes our hair to fall out. If we're going to put a poison in our body, we want it to be attracted to the cancer cells. And by using the RIFE along with the chemo, I think you're going to have a greater degree of targeting or attractant from the cancer cell to the chemo. So I think it can be a huge benefit to couple the RIFE with chemotherapy. If you're going to do chemotherapy, do the RIFE at the same time. Not at the same time you're getting the infusion necessarily, but when that's flowing through your bloodstream, that chemotherapy, and it's in your body, if you go home and do the RIFE, I think it's going to target the cancer cells much better, and you're going to have a better result of the chemotherapy. That's my belief. So we want the chemo to work as best as possible. We want the chemo to target the cancer cells as best as possible, and we want the chemo to leave the healthy cells alone as best as possible, and I think the RIFE does a wonderful job of that.
Right. So the only contraindication regarding the RIFE and its attachments that we would have more in association with doing chemo is at what point in time during your chemo session are you doing the ion ProWave?
Well, the ion ProWave, the purpose of the ion ProWave is, depends on what program you're running with it, obviously, but typically we have cancer patients run detoxification programs with the ion ProWave. So it is contraindicated to run the ion ProWave with detoxification programs for about 48 hours after you receive chemo. Or if you're on a chemo that you're taking every day, well, then we might want to talk about that again. How strongly is it pulling the chemo out of you? that's a question of debate. If you're doing a chemo that's lasting 5 days and then you're off 3 weeks, I would not do the foot bath for those 5 days, and I would wait another 48 hours after those 5 days before I do the foot baths again. Most people are doing chemo infusions for one given day, and then I would wait after you come home from the clinic from that infusion. I'd wait 48 hours before I do a detox program or hit the detox supplements real hard. So that's a different story. You're not running cancer frequencies when you're doing that ion foot bath necessarily. What we're talking about is using the RIFE, running cancer frequency, so it's affecting those cancer cells, and I believe strongly that it will increase the effectiveness of the chemotherapy, and that's what we want. If you're going to do chemotherapy, we want it to work, and I think the RIFE helps that.
And we want it to work with the least amount of chemotherapy possible.
Sure.
So, well, thank you very much. That makes perfect sense.
All right. Bye-bye.